Hello, my name is Ariana Anaya, and I'm a Senior Enrollment Manager with Foundation Communities Insure Central Texas program. And today I'm going to be taking you through our step-by-step guide to enrollment to get you ready for the fifth open enrollment season. I wanted to start by talking a little bit about Foundation Communities, which is our larger parent organization. Foundation Communities got its start as an affordable housing program. We are a local, homegrown Austin area nonprofit with 22 affordable housing sites in Austin and North Texas. That includes 6 single occupant residencies and 16 family communities. The family communities in particular offer a variety of services on certain sites for adults and for children and teenagers. We are also very excited about a couple of future sites. Cardinal Point in the Four Points area should open at the end of this year. And we're very, very excited that we've recently been approved to build the Jordan in the Mueller neighborhood, which we're expecting to be completed in 2019. Foundation Communities also has 2 community financial centers, one located at the 5900 Airport Boulevard location and the other at 2600 West Stastny. Those 2 sites both offer College Hub, financial coaching, tax services, and health insurance enrollment. Consumers can call our main line, that's 737-717-4000, to speak to either of our 2 navigators. We're very excited to have one line that will connect consumers to both sites, and they can call if they have questions or want to set appointments, and we will be happy to assist them. So, my own program, the Insure Central Texas program, last year provided enrollment services for 4,709 individuals. That's the number of people enrolled during open enrollment for 2017, which ran from November 1st until January 31st. In that time, we were able to claim $15.6 million in premium tax credits and to assist almost 2,000 Austin area musicians with accessing health coverage, a partnership we're very, very pleased with. Since that time and throughout the 2017 year, our enrollments have grown to over 5,000, but this is the impact of our open enrollment for 2017. We do this because we are a known entity in the community. We get referrals from 86 local partners who we provide with support in whatever ways necessary and who we offer presentations and assistance to, and they refer consumers in our direction. We are also unique in that a lot of our enrollments are done by volunteers, and this past year we had 61 volunteers provide 2,264 hours of assistance with enrollment. We are also locally funded. This list comprises our 2018 funders, which include Central Health, the City of Austin, St. David's Foundation, and Seton. And I bring this up because there has been a lot in the media about organizations that do enrollment assistance losing their federal funding, and that's something we are lucky enough not to be impacted by because we have these wonderful local funding sources. Since the beginning of the marketplace, since 2014, we have enrolled just under 23,000 people in health insurance, and we've claimed over $60 million in premium tax credits. So that's our impact since the marketplace started. Today we're going to be covering a couple of things. I'm going to give a brief overview of the Affordable Care Act, and I'm going to spend the bulk of today talking about the 7 steps of enrollment, but I will also briefly talk about some of the premium assistance programs we offer and assist with that are specific to our Central Texas area that essentially sit on top of the assistance offered by the marketplace and offer consumers some additional support, usually with their premiums. I will warn you that we're going to cover some very big and sometimes daunting topics like immigration, tax household, and of course health insurance. But I do want to emphasize that at no step in this process are you on your own. I will refer repeatedly to the resource page, which you can access by going to helpenroll.org. Look for the 2018 tab at the top. The password is capital I, capital C, capital T, as in Insure Central Texas. And you'll notice our resources that we've created for all our certified application counselors. We also provide tons of support in terms of managers who are there to answer questions and clarify confusion. And we will be shadowing your first enrollment and offering you the opportunity to shadow an initial enrollment when you show up for that first date of your assisting. So the 7 steps of enrollment, which you can see laid out for you on the resource page and also on our tracking sheet, are consent and survey, employer coverage, tax household, income, application and eligibility letter, plan selection, and then the next steps. And I will go through each of those one at a time. So I'm first going to talk about the major provisions of the Affordable Care Act, and this image, of course, is President Barack Obama signing that into law. The first major provision is guaranteed issue, and that essentially requires insurers to provide insurance to individuals with pre-existing conditions at no additional charge, or of course they are not allowed to be denied coverage on the basis of those pre-existing conditions. It also set a minimum standard in place in terms of plans regulated by the Affordable Care Act. It used to be that a consumer would sign up for coverage and would learn later on down the line that their coverage did not cover hospitalization or surgery. That is no longer legal after the Affordable Care Act because plans are required to cover certain minimum essential health benefits. The Affordable Care Act also created the individual mandate, which means that if you are over a certain income level, you are required to have health insurance or pay a fine. The Affordable Care Act also created the health insurance exchanges. We in Texas use healthcare.gov, the federal exchange, but certain states created their own exchanges through which consumers could access the different plans. The Affordable Care Act also created subsidies for low-income households. I'll go a little more into detail in that later on. And the Affordable Care Act was intended to expand Medicaid, which has taken place in quite a few states, but Texas, unfortunately, is not one of those. So at the moment, you'll notice I'm saying that mostly nothing has changed. We had a couple of repeal and replace attempts go through the House of Representatives and not go through the Senate. We did have the Graham-Cassidy amendment that also did not pass. And we have had a more recent change, which is that the administration has made the decision that the cost-sharing reductions will no longer be paid by the administration, that the Treasury will no longer cover those costs, which means insurers are now, for the remainder of 2017 and for 2018, required to cover those costs. And I will talk more about that when I get into the subsidies. However, what's important here and very important to communicate to consumers is that as far as the plans they're in for 2018, nothing has changed. As far as the plans they're in for 2018, nothing should change either. What we know at the moment is the mandate is still in effect. So consumers who do not have health coverage, if they are above a certain income, may be fined for not having health insurance. We also know to expect a shorter open enrollment period for 2018. So instead of the 3 months we had last year, open enrollment for 2018 will run from November 1st until December 15th. We always work very hard organizationally to locate the silver lining. And the silver lining here is that with these open enrollment dates, you will have one start date, January 1st, for all 2018 plans. That means one deadline to pay and one deadline by which you can expect your insurance to start if you've paid. It used to be when we had a 3-month long open enrollment, when you signed up dictated when you had to pay and when your coverage started. And that was sometimes very challenging for consumers to remember and stay on top of. So we're trying to look at this as a benefit. It simplifies what we need to communicate to consumers. We also know for sure that there will be much less, if any, federal funding for notifying consumers of this update. And the good news is that we are calling all consumers who've ever enrolled with us and notifying them, and specifically advising them to come in by the 15th what to bring and what the status of the ACA is in terms of our local marketplace. We also, of course, have amazing partnerships locally that are helping us get that message out. For 2018, we are not expecting to lose any of the insurers we had in the 2017 marketplace. So the Sendero Ideal Care plans, the Ambetter plans, and the Blue Cross Blue Shield plans, as far as we understand, are expected to still be in the 2018 marketplace. Central Texas also has a unique benefit, which is we have an additional insurer for 2018. So we will be adding one more insurer, one more than in the 2017 marketplace, which is Oscar, which is very exciting for us locally because that is, of course, not necessarily a story that you're seeing across the United States. That's something very, very unique to us. So the tracking sheet. The tracking sheet is going to be your tool for all your enrollment needs. It's going to walk you through the enrollment, and it's also going to help us monitor the enrollments that we're doing. So a couple of pieces of advice on the tracking sheet. We have refined this over the years, and it really at this point will help you be the most efficient, effective enroller possible. Most important, of course, don't skip the steps. Those steps are designed very specifically, and the order, of course, is quite important. The trickiest part of our work is that we deal with human subjects, and I think that humans tend to derail bureaucracy and paperwork more than anything, and that's fine. That's perfect. That's the joy of our work. But I highly recommend as much as possible letting them know that we have enrollment tasks to accomplish today. And while they may want to delve right into their life story or their entire situation, as much as possible, stick to those steps. Let those steps organize the conversation and the enrollment. And as much as possible, I have a secret program goal for us that means we will do enrollments, we'll complete them in under an hour. That's not always possible, and I will acknowledge that. When a household is complicated or a person's specific situation is complicated, an hour may just not be reasonable. But my goal for us this open enrollment season is going to be more often than not sticking to an hour-long enrollment. All right, so step one, you can see in the left corner that this is how it looks on the tracking sheet, and the right bottom corner, this is how it looks on the resource form. The resource page. Why do we do this? So we do this because CMS has certain requirements, obviously, but we also do this because it allows us to capture important information about the individuals we are enrolling, to provide reports for our partners and our funders, and to provide our internal reports for us to measure our impact. Consumers will first authorize us to get their information for purposes of the application, and then they complete a second survey form. And that survey form contains information that teaches us who they are, who we're enrolling. So these are very, very important sheets to be completed. This second form is going to get entered at intake before the consumer is passed to the certified application counselor. So mostly this won't be a step that certified application counselors have to deal with. It'll be all done for you at intake. You'll notice that the tracking sheet has certain eligibility screening parts to it. So there is a checkbox for the fact that the consumer, if they're going past this step, we have screened them and found that they are eligible to purchase a marketplace plan. This means that they do not have free Medicare Part A and that they are not a DACA or undocumented status. And those are three statuses that are not eligible for the marketplace. Intake will catch them at this step and refer them elsewhere as necessary. You'll notice too a checkbox for paper consent being signed and completed, a checkbox for the consent being entered, and then you'll notice that we do need to know the county where the consumer resides because some of the premium assistance programs that we assist consumers with require a consumer to reside in Travis County.